Hello lovelies, and welcome to today's video. My name's Alya and I'm so glad you stopped by. So you're probably thinking, what is she doing with these crazy eyebrows? And today is going to be a special video. Today we're going to be recreating Anne Hathaway's look in her new movie inspired by Roald Dahl's Witches. So we're going to fully transform into Anne Hathaway's witch character, and we're going to be talking, ironically, because I do love a good irony, about kids' eye health. So I'll be talking to you all about the different things you need to look out for, things that you need to notice as a parent especially, or you know, an aunt or an uncle, and so forth and so on, and a little bit about what goes on in their little lives until about age 12. So please go ahead and stick around and hear all about kids' eye health, and also to recreate this look. Should be so much fun. When babies are just born in the hospital, they will get a little bit of an eye checkup or a general checkup, including their eyes, by the team. They check for all the different signs that everything's kind of a-okay, and the pediatrician will come and visit them in their rooms, and she'll also have a look at some basic things, including the eyes. You know, breathing and hearing and all that sort of stuff. All the major things do get checked before you go home. If you have anything to worry about at birth, they'll generally pick it up at the hospital, so you can concentrate on getting to know your baby, and of course feeding and all that sort of stuff. And you know, if you're a new mum, then there's a lot to learn, and the last thing you need to be worried about is all the bits and bobs that the medical team should be looking out for. So here in Australia, we're pretty lucky. They tend to, you know, look out for all that sort of stuff. Even though I was qualified to check my baby's eyes, I never even had to, was my experience. And then when you get home, within the first week of being home, my experience was the next day, somebody will come from council and also look at your baby and look at your home, and you know, have a quick chat and get you going. Things are pretty straightforward in that first little kind of fortnight. By the 6th week, you will have a checkup, and so will your baby, with your GP, or if you opt to, you can also go to a pediatrician, and they'll go over all the major things. So sleeping, eating, weight gain, all that sort of stuff. You know, what's coming in, what's going out, all that kind of good stuff. And of course, eyes and hearing is a part of that. It's raining outside. I don't know if you guys can hear that, but it's pretty heavy rain. Once you've had your initial checkups, that's kind of it. And you don't get anything else till they're about 3.5. So between that first sort of week of hospital and then 3.5, the only person that you see, unless you choose to go to the GP or you choose to go to a pediatrician, is your maternal health nurse. So my advice is to try and get one that's really onto it and quite experienced and cares about all the different things, not just weighs, measures, and see you later. You know, one that can really give you good advice and tips and things like that, and really does check baby's health every time. At the 3.5 mark, they will have a proper vision test, and it's usually done with little cards, standing at about 3 meters away, and baby, or now toddler, gets to wear a little eye patch, like a little pirate patch, and they'll normally either name letters if they can, which would be awesome by 3, that'd be pretty impressive, or they name either little figurines that look like things like a house, a phone, a cat, very, very straightforward things. So they're usually it's called a Lee picture test, or they sometimes can do things like figures instead, so square, heart, circle, things like that. It depends what your practitioner or your nurse is carrying or has at the office, things like that. They usually do have letters with them, but I mean, how many kids can say their ABCs by 3.5, right? So that's all they're doing. So it's a really basic screening test. The biggest thing you're looking out for until that age isn't even so much how much they can read at that distance, but rather, are they resisting to the test in the first place? Before 3 years of age or 3.5 years of age, if your child is resisting having one eye covered and only ever wants to look with one eye and hates having the other one covered, it probably means that one of them isn't seeing so well. So when you cover the good eye and all they see suddenly is not as much or not very good, they get really, really distressed and upset about it. So that is a really good indication that something is really amiss. That's the biggest sign, and that's usually only if it's really extreme or if both eyes aren't just as bad as each other, because that could also happen. And I've actually found a really great site that gives us a few kind of hints and tips about what to look out for if your kid isn't seeing well, what they'll be doing. And I really love it. So I'm going to post it below. It's kidshealth.org. And I really, so far from what I've read, really love what's here. So it's really, really good and really, really sort of non-scary, non-stressful tips. So they're saying constant eye rubbing, and that is absolutely it. They think that there's something like dirty in their eye, and I guess 70-year-olds will do it just as much as 7-month-year-olds will do it. You know, if one eye is seeing really well and the other one not so much, they'll just keep rubbing the one that's not seeing so well because they think there's something there. You know, it's just logical. They don't know any different. They don't know what's normal. So they will never tell you, oh, this eye doesn't see well, mummy. That'll never happen. They just think that everyone's the same as them. They have nothing to go on. So they'll just rub. The other thing is they might do this. They might sort of do this squinty face. And that's because eyes that don't see well, A, they're trying to focus, so they squint to focus, but also they're really light sensitive as a rule because, you know, they're sort of having to focus so much harder to see anything that they have to sort of be a little bit more, I guess, making more effort to see. More effort to see means the eye is kind of overexposing itself to light. Light isn't pleasant even if you need it, so forth and so on, says she with the ring light right now in her eyes. But it's that sort of principle there, where if, you know, you've got too much information going on or you're trying to seek out more information, imagine yourself, you know, trying to drive at sunset or something like that. You need to see, but it's really hard. So you're looking to see, but it's also really sore to see. So you might get that squintiness, that light sensitivity, and of course the eye rubbing. You might also see that the eyes aren't aligning properly. So when you look at my eyes right now, you should see an equal reflection in each pupil, and that the ring light that is shining in my eyes right now should have a similar position on both eyes. And that is what we all should have when we're looking straight ahead. I'm of course a little bit on an angle here, but it's kind of a rough indication, and you're never really going to get a kid to look at a pen torch. They hate it. Even perfectly sighted kids hate pen torches. So you're not going to get them in a perfect clinical environment. But even if they're just looking at the TV, or they're looking at an iPad, or they're looking at just a room light, you will get a reflection in each eye. And when they're looking directly at it, it should be equal in each eye, or equally displaced in each eye. So let's say it's in the left third of this eye, then it should be in the left third of this eye, so forth and so on. So as long as that's equal, because if the eye is suddenly turned, so one eye is looking in and the other one straight, like that sort of thing, or one is turned out, God forbid, then you see that the reflection is different. So for example, I'm going to try and make my eyes do it again. Ready? So let's say the right eye is turned or the left eye is turned. I can of course do it voluntarily, but kids can also do it voluntarily up to about 3 years of age. So as long as they're not doing it all the time, or it's not there, you know, consistently when they're tired or they're not mucking around, then you need to really present to at least an optometrist. There they'll be able to use a special device called retinoscope, where they put up lenses, shine a light, and depending on what reflection they see through their little scope, they'll be able to determine whether there is a prescription there or not, whether your child needs glasses or not, but more importantly, whether each eye is seeing equally or not. Because if the eyes are seeing differently, it is extremely important to correct especially the worse eye, and potentially patch the good eye if there is an uneven vision already. Because if you don't do it ASAP, potentially that weaker eye, that lazy eye, will never have full potential vision, and they develop what's called a scotoma, or a sort of like a patch of missing information in their center, and they don't see 3D and all that sort of horrible stuff. So the earlier you get your kids seeing, the better. Now this is where it's really important to sort of screen them early. Don't think that just because they don't know their letters or they don't sit still or any of that stuff that you shouldn't present to an eye clinician. They have their ways, believe me, they have their ways of at least determining a rough indication and enough to know how to treat. Definitely if they should be treating or not. The importance of presenting early enough, and so we're talking before 4, well before 4, is so imperative. So up to about 2 years of age, the eye system in the brain. So we have to determine one thing before we start talking. The eye itself does not see. No one's eyes actually see. All eyes are a giant receiver of light. We have beautiful 10 layers of really important, really very, very perfect cells doing a very intricate interrelative job to receive light and to receive information of whether the light is green, red, blue, whether the light is bright or dull, where it's coming from, all that sort of stuff. It's a wonderful mapping device, a signaling device. Think of it like a switchboard of a big city's telephone system, yeah? all the calls are coming into the eyes, but the actual conversation, the actual context of that call is happening back here, right back here where you've got these two lumps at the back of your head. It's called the occipital lobe, and all of our vision stuff, all of our vision happens back there. And it's a very, very intricate system that works really, really well between the two sides, so left and right cooperating extremely, extremely well with each other. And yeah, so that's the part that develops extremely, extremely before age 2. And this is at a time when the world is just over here. You know, the world is basically within 2 meters of them. What do they see by 2? They see their toys, they see their books, their mums' faces, whatever, their relatives' faces, their food, you know, that sort of stuff. They don't really see all that much before they're sort of too mobile. Then when they start moving around, it sort of goes hand in hand with their mobility. They start to get a little bit more vision further away. They start to see things like television sets and, you know, things that are about 3-4 meters away. But not much more than that until probably age 4. By age 4, they should be seeing their full amount. They won't have perfect vision like an adult. There'll be a normal eye will be relatively long-sighted, so it'll be a little bit blurred at very long distance, but they can have amazing skills with their muscles. So they see really well. If an adult had the sight of a 4-year-old child with a normal eye, they wouldn't see so well. But the child's eye is so good at accommodating and so good at adapting that they see really, really well. So, you know, you've got this amazing system, this really powerful eye, but things can go wrong. So they adapt super well and will never know that things are going wrong. And that's kind of the point here, that you need to be able to pick up on even the slightest little sign of any kind of squinting, any kind of rubbing, any kind of side preferencing, especially if they don't want to shut one eye for any reason. So if it was me and you had any kind of family history, I'd be presenting my child to an optometrist, even without any reasons to worry or complain, before 3 years of age, or around that 3.5 years of age. So even with the screening happening with the maternal health nurse, I would just in case present. That's if you have a family history. If you don't have any family history and you don't have any signs or worries, your child's not complaining or doing anything strange about their eyes, they're not squinting, rubbing, they don't hate things being presented to them on one side, or they're not ignoring things on one side, they're not, you know, playing with their toys specifically to the right or to the left, things like that. By 4, I would still have a proper eye test done at an optometrist at least. Here in Australia, optometry should be bulk billed, so it shouldn't even cost you anything. It should be covered under Medicare. And it's usually just a 15-minute kind of gameplay. They look at some pictures, they look at a fun cartoon or something, and, you know, go to someone who's experienced with kids, because it is a bit of a specific kind of testing. And if they have a problem, if they consider that there is an issue, then the optometrist will put drops in your kid's eyes. And that can be really uncomfortable. It can be an uncomfortable situation, but it's well worth it. With those drops, giving about half an hour for them to work, your child comes back and has that light test done again, but this time those really strong, amazing muscles, they're not doing much. They're knocked out by the chemical that's in the drops. They're very light sensitive, so the response is really amazing in that special light test. It doesn't hurt them at all. It's just really uncomfortable. And then we get a really good reading. And with that reading, we can actually prescribe pretty accurately a pair of glasses if they're needed. But normally that test actually shows us that what we were worried about isn't there at all, because once we knock out the muscles, all those queries get knocked out too. The other thing you really need to look out for in children, especially when you're looking at the reflections of their eyes, is if their pupils are both reflecting pink. So when a child has a bright light in their eyes, or maybe even on a photograph, the photograph's probably the best thing, because with the flash being so bright, you're going to see everything on that photograph. You should see that typical red eye kind of look. You shouldn't really get anything other than red eye with kids, especially if both their eyes are the same. Sometimes kids will get this green or white looking reflection. That unevenness is usually an indication that there might be something growing in their eye and making their retina, which is what gives you that red reflex, change color. So you're especially looking out for a white reflex, or like a kind of creamy reflex. If you're just having a green reflex, I mean, shoot some more photos to be absolutely sure that it's never pink, because sometimes it's just the angle of the camera and you're just catching a sort of different reflex. But if it's a distinctive white section to the pink, or it's consistently there, no matter what angle you take or what, lighting it is, or, you never really get a pink reflex or a red eye kind of pupil response in your child, I'd be just getting a screening done. Again, doesn't matter how young they are. Optometrists, especially those who know what they're doing, and even more so ophthalmologists and orthoptists, definitely know what we're doing. If we're dealing with kids, if we don't deal with kids, we just typically, like in my experience in Melbourne, if you're not a pediatric ophthalmologist, you just don't see kids. Oh my gosh, I'm just catching myself in my viewfinder and seeing this, talking about kids, and the irony of this idea, I love it. So what sometimes happens is if there's a growth in the eye, and it could be a cataract. Some kids are born with cataract, and that's fine, that you can deal with that. And some kids are born with what's called a retinoblastoma. Now that's where you've got some really, really serious things to deal with, because that is a type of cancer, and it can be in one eye, it can be in both, rarely, but it can be in both, and that's something you've got to check early. The other thing you want to look out for, and this is a bit harder to see if the kid's eyes are a bit darker, but in light eyes you can also see these little freckles. So if your kid's eyes have freckles, that's another reason to be seeing someone, just to make sure that they're just little pigment spots and there's nothing to be worried about. Otherwise, you could be looking at a genetic disorder that could mean a whole bunch of things for the rest of their body also, and they get these little sort of gingery spots on their irises, on the coloured part of their eyes. Obviously harder to see if they're brown or dark, but still very visible, especially kids, because they tend to have a greyish blue eye rather than a dark eye. So what do you guys think? Think Anne Hathaway would have been proud with this look? So I don't know, I feel so much scarier than she is. She's still so pretty with this look. I just feel like I'm wearing black lips and it's just not my jam. But I hope you like this transformation to this is me if I were a witch type thing. Can't stop laughing, hold on. And I hope that you found the eye information on kids informative. I would be kind of keen with kids to be seeing at least an optometrist with anything, because they can really give you with an experienced opinion what is serious or what can be ignored and is pretty normal, because everyone's eyes have something different about them. That's quite standard. No two eyes in fact are the same, let alone two people's eyes. But if there is a family history or there is any kind of concern, don't feel like you're an overzealous parent or aunt or teacher or whatever. Please do encourage the parents or guardians to present to at least an optometrist, at least a primary carer. Then you can sort of discern whether there's a need for an orthoptist or an ophthalmologist to see this child. Sometimes kids just have eye infections or blocked tear ducts, or there's a myriad of things that kids can get, but those are the ones that I would suspect would have some sort of urgency on it. If there is just a bit of a blocked tear duct, my favorite treatment for that is just breast milk. Breast milk on a newborn with a blocked tear duct it's like probiotic heaven. So, try that. There is definitely antibiotics you can try too. Most newborns grow out of it. Sometimes by age 1, there is a need to sort of unblock it. That's fine. It's not a hugely traumatic procedure. It's just that, things are very tiny, teeny tiny when they're born and need a little help developing. So that's not a big deal. It's just an unfortunate thing that the child has to go through. All right, guys, I'm going to go and wash this off because it is scary, and I hope my kids don't see me because they'll jump out of their skins. But yeah, I hope this was fun. I thought it was appropriate coming to the end of October to do something fun like this. And Anne Hathaway, I am a huge fan. So it's only an honor to represent something that she's doing. And I hope all of you are doing well. Please subscribe if you haven't already. Check out Instagram if you haven't followed me already there. Like if you liked my crazy eye kids segment, transforming myself into this. For more stuff, you know where to head. There's tons of makeup tutorials, eye talks, tickle tutorials, wrapping tutorials, all available on my channel. Please do check them out. And wherever you are around the world, I hope you're doing great. I'll see you on the next one.